Well, my name is Amanda, and I'm going to be your nurse for today. We're going to be doing a blood draw off of your heparin locked tunneled line, and then I'm also going to do a dressing change for you. And so I just need you to verify your first and last name and then your date of birth.
Name, date of birth.
Perfect. So the reason that you got your central line in is because of your cancer diagnosis. And I don't see that you're hooked up to any infusions, so we're just going to go ahead and get started.
Perfect.
Okay. I already did the introduction. I've already done my hand hygiene. So I'm just going to go through the equipment. And then you can pause again.
Oh, you wanted me to pause?
My dressing change, that will be my sterile technique used, as well as my syringes for saline flushing, also wasting. I have my vacutainers, and I have my chemistry tube and my CBC tube for drawing blood, as well as a new cap, and alcohol prep pad, and then of course I have my biohazard bag to send samples to the lab. All right, so I'm going to do my hand hygiene, and then put on my clean gloves. All right, so we take off our cap, and we're going to clean the hub, scrub the hub for a count of 15, and 12, 13, 14, 15, and scrub. We are going to prime our saline, and we're going to pull back and aspirate blood to the line, but not into the syringe, and then pulse 10 cc's, 10 mils in through the line. That is garbage. And then we're going to take a sterile syringe, attach, and we're going to waste 5 cc's of blood. And that's going to go off to the side into our sharps container. And then we're going to take our vacutainer, and we're going to place in our glucose, and we're going to wait for that to fill to the line, and it'll slow down, and then we're going to remove it, and we're going to invert it 8 times, 5 times. We're going to invert it 5 times. And this is why I have my CNA Alyssa with me. And then we're going to do our CBC. Again, we're going to fill it to the line. It'll slow as it goes to the line. And that one we are going to invert 8 times. Then we're going to remove our vacutainer, and that's going to go into sharps. That can go into garbage. And then we're going to prime 10 mils of saline. And we are going to flush that 10 mils of saline with a pulsing action through the line. And that can simply go into the garbage. And then, because this is a line that is heparin locked, we are going to inject 3 mils of heparin. And we are going to be pushing until we hit the 3 mil mark, and we're going to lock it and continue to push so that there is positive pressure. And that is going to go into our mid container, and then we're going to put a new cap on there. All right. And then I'm going to get the patient's labels, and I'm going to verify one more time first and last name and date of birth to make sure that I have the right patient. And I'm going to apply the patient labels and place the blood into the bio bag so it can go to the lab. All right, so now I'm going to do your dressing change. So I'm going to go ahead and I'm going to do hand hygiene again. And I am already wearing a mask. So I am protected. All right, so if I could have you actually turn your head I'm gonna take a peek here and see if there's any, is there any tenderness as I'm doing this? Any pain around this area? No? What about through here? No? What about through here? No? And I see no signs of redness and I see no signs of swelling. So patient states that he is not feeling any pain. There is no tenderness and there is no swelling. So I'm gonna go ahead and remove the dressing, and I just do that by finding the edges and peeling outward and outward and outward and outward and outward and outward and outward until it comes off. Okay. And then I'm going to throw the old dressing into the garbage. And I'm going to assess again because I have now removed an adhesive from the patient's skin. I see no skin breakdown. I see no tenderness. I still don't see any swelling. And is there still no pain when I am doing all of this through here? No pain? What about through here? No? Okay, so I have assessed the site and there's no pain, there's no swelling. Okay, so I'm gonna go ahead and measure and just make sure that your catheter hasn't moved and the line hasn't moved. So just go ahead and stay nice and still, and I'm still seeing that we are looking at about 17 centimeters. So we're still okay because according to the MAR, it was at 17 centimeters the last time. So we are still good. All right. Alrighty, so we're now gonna go ahead. I'm gonna do my hand hygiene. I'm gonna go sterile. And I'm going to do the dressing change. So, my kit, open it up. My adhesive. And I'm just going to go ahead and place this underneath the patient's torso. And all right, so now that I am sterile, I'm gonna go ahead and get the scrubber and I'm going to crack it open and I'm going to hold it upside down and count 10, and we're gonna go ahead and I'm gonna scrub on the inside portion of it here, and I'm gonna lift and go underneath, and I'm gonna continue to go to the outside until the entire area is scrubbed. That is now garbage. And then I'm gonna let it dry. And I'm still inspecting. I just got done doing a blood draw, so I know that everything is fine there. And I'm going to get my new dressing. Again, still sterile. And I'm gonna peel this off. And the peel's gonna go into the garbage. And then I'm going to apply the new dressing and remove this outer portion of it here, sticking to the patient. Also remove this piece of tape that says initials date here. And I'm gonna place my initials and the date on there. Okay, and go ahead and stop. Okay, so now that your dressing has been changed, we did your blood draw, I'm all finished up here. Are you comfortable the way that you're sitting in a semi-Fowler?
Yes.
Okay, great. So I'm gonna go ahead and get rid of that. And if you have anything, here's your call bell, and please let me know if you need anything.
Thank you.